It was easily the most pain I've ever experienced. I've dislocated my elbow before, so think about that. You know it can't feel good, and I can tell you when I pulled my lower back, it felt way worse than it did when I dislocated my elbow. So I've been there, I get it. I've spent the last 10 years rehabbing clients and patients with chronic lower back pain. What's up guys, Dr. Wes Hendricks, and what I want to cover in today's video is easily my favorite exercise for the lower back, whether we're trying to rehab a patient back from an injury or trying to prevent that injury altogether. Let's keep this simple because I know if I get too excited about talking about the intricacies of lower back pain, you guys are definitely going to click out of this video. When it comes to your lower back, we want it to move forward, backwards, and side to side. For good measure, it also helps to have the areas above and below the lower back moving or working well. So in this case, think the thoracic spine and your hips. If you head over to Dr. Lehman's site, he discusses the importance of mobility and how it relates to movement options, performance, and even pain modulation. Pain modulation isn't what you're thinking. Pain is multifactorial, and we just can't blame limited mobility or compensations as the cause. This is awkward. Imagine it's your first time with this person and your back gives out. So here's my simple argument on why you want to move your spine in multiple directions. Variety's good. The beauty of this movement is we're hitting 4 out of those 5 qualities. So we're getting moving backwards, side to side, the hips, and the thoracic spine. Let's get into all the variations because I wasn't lying in the title. There's a variation for everyone. Let's talk about setting this up. We're gonna be kneeling. If you find it uncomfortable to have the back knee directly in contact with the floor, by all means throw an ab mat, throw a cushion, throw something on the floor just to provide your knee with a little bit of support. Kneeling is gonna shorten your lever length, making balance easier because you only have to control from your knees up versus from your feet up. For the setup, angle your front foot at roughly 45 degrees. Ideally, we want a straight line from your front heel to your back knee or foot, depending on what variation you're doing. If your right foot is going to be forward, your right hand is going to be reaching back, and you can place your left hand across your chest. With all variations, we're going to work through 3 progression distances. The first one being when you start off, you want to aim to touch the back of your knee. This is a great starting point, and it helps you establish your balance with the movement pattern. Once you're nailing this every time, you can start to move on to mid-calf. Lastly, once mid-calf becomes easy, you can start working towards your heel. Once you're hitting your heel every time and you find this relatively easy, it's time to progress to the next variation, which is going to be standing with the front knee bent. Keep in mind, once again, the same principles apply that did when kneeling. We want our front foot heel to be in line with your back foot, the front foot angled at 45 degrees, and if our right foot's forward, we're going to be reaching with our right hand. Just like kneeling, we want to first aim at reaching the back of our knee. Once comfortable with this range, we progress to mid-calf. And who would have thought? We start working towards the heel. Lastly, we're going to get to the final variation where we keep that front leg straight. That front leg being straight is going to increase the amount of stretch we feel in our back leg hip flexor. This is going to increase the amount of hip extension requirements. Setup's going to be exactly the same, guys. We want that front foot angled at 45 degrees, in line with that back foot. If the right foot's forward, we're reaching with the right hand. Left foot's forward, we're reaching with the left hand. Once again, going through the same exact progression series. First aiming for the back of the knee, progressing to mid-calf, and finally ninja status, the back of the heel. Common error time. Let's talk about how people fuck this one up. This first one might not even be an error as much as it is just a total inability to follow directions. And that's rotating to the wrong direction. People's right foot's forward, and you guessed it, they reach with the left hand. The next one's going to be actually reflective of a real error, and that's going to be performing the movement with almost exclusively spinal extension, neglecting the lateral flexion and rotation component. This is quite common, most likely because we rarely, if ever, train lateral flexion or rotation, so it's a really foreign movement pattern and takes some getting used to. The next one, whereas it's going to be much more uncommon than the previous one, is going to be the complete opposite of the last one. So in this instance now, we're neglecting spinal extension and almost exclusively using rotation to accomplish the goal. There you have it, guys. That's all I got for this week. And if you guys have questions, comments, personal back pain stories, let's hear them in the comment section. And be sure to subscribe if you haven't already, and I'll see you guys next week.